plan to extend quarantine to 21 days for African travelers to deal with new South African strain. Public health officials are determined to keep the South African variant of COVID-19 out. Reports from the UK say researchers and scientists working with the AstraZeneca vaccine are confident of having a fix available in the autumn after the vaccine, favoured by Thailand, was suspended by South African authorities last week when shown to be only 10% effective against the new strain. However, experts say it still appears to be effective at preventing acute illness and hospitalisation from the disease. Thailand's public health officials are scrambling to react to any potential problems posed by the more infectious South African strain of the COVID-19 virus known as B1351, which has the potential to disrupt the country's vaccination plans as it gets ready to fly in its first load of vaccines from China next week on the 24th of February. With 3 travelers currently being treated in quarantine by doctors for the strain, there is now a proposal to extend quarantine for African travelers to 21 days as test and genetic sequencing capability is also being ramped up. Department of Disease Control boss, Dr. Opus Kangkornpong, has assured the public that the more infectious B1351 strain of the COVID-19 virus from South Africa will not enter Thailand through the state quarantine system as doctors currently treat 3 patients with the strain detected in the last few weeks. The Center for COVID-19 Situation Administration is thought to be actively considering a plan to extend the period of quarantine for travelers from Africa after it was confirmed there have been 3 cases detected in state quarantine over the last week. We might need to increase the mandatory quarantine for returnees from Africa to 21 days, said spokesperson Episames Risingson this week as concern about this more contagious strain grows. 41-year-old dealer treated for a severe respiratory infection after testing positive in quarantine. The first case treated, a 41-year-old Thai gemstone dealer who had been in Tanzania for 2 months and who travelled back to Thailand via Ethiopia, arriving in the kingdom on the 29th of January, has provoked searching questions within the top government unit and the Department of Disease Control at the Ministry of Public Health led by Dr. Opus. The infected man who developed a severe respiratory infection is asthmatic, overweight and suffers from a congenital condition. He was treated with the drug remdesivir and is reported to be making a recovery. Delay in diagnosing the COVID-19 strain. While he tested positive for COVID-19 on the 3rd of February, it was not until the 12th of February that doctors diagnosed the South African strain of the virus known to be extremely infectious and significantly for Thailand, less treatable by the current version of the AstraZeneca vaccine, which is the proposed mainstay of the kingdom's vaccination campaign with 61 million doses on order from the UK-Swedish firm. Last week, authorities in Pretoria, South Africa ordered the suspension of vaccinations using the AstraZeneca jab after it was shown to be only 10% effective in combating the new virus strain named by scientists as B1351. Scientists confident of adapted AstraZeneca jab by autumn as a top doctor in Thailand orders a search for the South African variant in swabs. Scientists who developed the jab for AstraZeneca at Oxford University are confidently working on adapting the vaccine to fight the new strain, but it is expected to be autumn before this will be ready for delivery. In the meantime, experts point out that the vaccine still appears to be capable of preventing acute cases of the virus infection which require hospitalisation. Meanwhile, Dr. Prasit Watanapa of the Faculty of Medicine, Siriraj Hospital, Mahidol University, who has strongly endorsed the need for a speedy rollout of a vaccine program in Thailand and the efficacy of such an approach, has reached out to hospitals nationwide to recheck swabs to see if the South African variant may already have been detected within the kingdom. Strain is known since October last year. The strain has been known about since October last year and has already spread to 30 countries. The current strain of the infection in Thailand, the G strain, is also quite infectious, as is the Kent strain from the United Kingdom, which doctors are now treating in the state quarantine system, with 9 cases of this variant among travellers. Department of Disease Control orders quicker testing and genetic sequencing of all detected cases in response to the latest development. The Department of Disease Control has ordered quicker testing of arrivals and availability of tests as well as genetic sequencing as the ongoing medical management of incoming passengers continues. Meanwhile, Thailand's first COVID-19 vaccines will be flown in by Thai Airways on the 24th of February from China. It will be the first batch of the Sinovac vaccine with 2 million doses to be administered and expected to arrive in the kingdom before the end of April. Move to allow vaccinated passengers enter without quarantine resisted for now by health officials. Last week, Dr. Oppus of the Department of Disease Control ruled out any swift decision on allowing vaccinated visitors entry to the country on vaccine passports without quarantine despite intense canvassing of the government by business and foreign tourism interests at this time. Top Thai official, vaccine passports a matter for the WHO. However, the hawkish public health official, tasked with the protection of the kingdom against the disease, has not ruled out the prospect under the auspices of the World Health Organization. Confident that South African strain will not enter through state quarantine facilities to spread in relation to the South African variant of the disease, he was also quite optimistic that it is a threat under control as regards state quarantine facilities. I assure you that the South African species, found in state quarantine, hasn't spread to any community, he said. Research last week from the U.S. Centers for Disease Control and Prevention may provide some more positive news but also highlights the complexity of this challenge. U.S. Centers for Disease Control and Prevention advisory offers some hope for an eventual end to quarantine with guidance on vaccinated people. Scientists in the United States are suggesting that a person who has taken 2 doses or a full course of an approved vaccine should not be subject to 14-day quarantine provided they are asymptomatic for the disease sometime after the second dose has been administered. It is thought by U.S. scientists that asymptomatic carriers of COVID-19 are less likely to transmit it. They are also suggesting that the person should have received the last dose within 3 months. Individual and societal benefits of avoiding unnecessary quarantine may outweigh the potential but unknown risk of transmission, the body concluded.